So this is James Burgess' sports medicine diploma. This is an examination of the ankle and foot, if anyone's got any problems in that area. So what we're first going to start off with, I know it's difficult with the camera to see, but what we're first going to do is get the person to stand up. So if you would stand up for me. And when the patient is stood up, we're looking at their feet, we're making sure there's no obvious abnormalities, any ulcers. We're then looking around the side of the feet, see if there's any problem with the arches, anything like that at all. And then if you just walk up and down, then we're just checking the gait, see if that's okay. Okay, so we're checking for any pain in the gait at all, any issues at all. So if you just put your feet together for me. So we're just checking for good alignment of the knees, no issues there at all. So you just put your head on there a minute. Yeah, just this way around next to the video. So now when we're just examining the feet area now, we're just now making sure that we've just had a good look at all. Feet there, there's no issues at all with that. And then just had a look, make sure there's no ulcers or anything like that, or calluses, any sort of that formation. Then we're just having a look and having a look at the different bony areas to see if we can find any specific problems at all. So first we'll start off with the toes at all. Just tell if there's any pain there at all. We'll start off with the phalanxes. Any pain there at all?
No.
Any issues there? Go down the metatarsal. Any pain there at all?
No.
So there might be pain in these areas if there's a stress fracture or something like that description. So looking at the malleolus here as well. Any issues there?
No.
Looking at the bottom of the foot as well. So we're looking at the heel, and then the plantar fascia then inserts in here, and there might be some tenderness in there. We're having a look at this area. There is actually some calluses on here, which could indicate some unusual wear pattern. So you might want to have a look at the footwear to see if there's any unusual wear on there at all. So we can actually see that there. And then we'd actually compare on the other side as well to make a comparison there. Other things are sometimes pain in the foot can be due to nerve issues, neuropathy. So we just do a quick sensory examination. So can you feel me touching you normally on the bottom of your soles here?
Yeah.
Same on both sides.
Yeah.
So we're just checking each dermatonal area here. So the soles of the feet, any
Yeah.
normal there,
Yeah.
normal there, and sometimes just up the leg as well, making sure there's no obvious issues with that at all. So once we've had a look at the area, we've tried to identify any problems there at all that we've looked at. We're going to actually just move the areas to see if there's any problems there at all. So if you just lift the ankle up a minute. So now we're looking at the range of movement there. So there's actually a good level, so about 90 degrees there, dorsiflexion. Same on the other side there. That's fine. And then just a plantar flexion, so down for me. Again, it's got good range of movement there. And then inversion, so if you just, that's it, so that's the foot going inwards and then outwards, and that's fine. So there's good range of movement there, it's pain-free, not worried about that at all. Next we're going to do some resisted movements, so if you just push down against my hand, so this is plantar flexion, so this is mainly gastrocnemius, but it's also soleus. So if we want to get rid of the gastrocnemius component of that, we're just going to bend the knee, as gastrocnemius is also a flexor of the knee, and we're just going to have to do that again. So if you just bend down for me, and that's more of an accurate description of soleus and that kind of thing. So there's no abnormality there. And then if we go up on the foot there at all, so again, no issues or pain with dorsiflexion. If there was pain with that, then the tendon is roughly in this area here, and you could elicit some pain, examination of that. If you just go inwards for me, so inversion is mainly the tibialis posterior and tibialis anterior, so again if there was any pain or weakness there, it could be related to that. And eversion outwards for me, again there's no pain there, but again that's the perineals that deal with that. So if you had any pain or discomfort there, the perineals go into the base of the fifth metatarsal there, so there might be some pain or swelling in that area, particularly traumatically with lateral ankle sprain, something of that description that could cause some pain or swelling in that area, and it could be associated with a perineal nerve issue. Also, if you had an inversion injury for any other reason, you could get pain, swelling in that area, and that could be a fracture there, stress fracture of that area at all. So now we're looking a little bit higher up as well at the mortise joint here, just as we've done movement of the joint. But sometimes if there is pain there, or even higher above that level, if you've had an injury in sport there, you could get high ankle sprain. So if you've got any swelling or pain in there, you may want to go on to proceed to do further investigations for that. If someone has had instability of the ankle before, sometimes we might go on to test for any instability in the ankle with an anterior draw test of the ankle joint. So this is performed by just placing some pressure over the tibia and fibula here, and then pressing the ankle forward a minute. So we're just going to lift the ankle forward here, just see how strong it is, okay? There's no laxity there at all, we just compare the same on the other side. Any issues with that? No, there doesn't appear to be any issues with that at all there. So obviously our examination would be tailored to whether the person has any particular problems with the ankle or the ankle or the foot problem at all. Sometimes there's an issue, you might be worried about the subtalar joints. There might be some reason to look into that. As part of a routine examination, it's probably not particularly useful to investigate on everyone, but sometimes you might be worried about that at all. So if we're looking to get the subtalar joint, it is difficult to examine that. So we're just going to bend it up a little bit there. And we're going to try and isolate the joint here, so we're just putting pressure on there, and just seeing if just going to rotate the thing. So if we just rotate the foot, if there's any pain in that joint there, we're worried about, might be some arthritis, we're worried about the subtalar joint there, associated with the navicular, which is on the medial side there. Worried about that, then there might be some pain when we move that joint, but that might not be a test that you do on every person at all. So that would be our examination of the ankle and the foot. Thank you very much.